Yeah, there we go. All right, so 3 types of joints. Who can tell me what kind of joint is this? Because it has a more specific name, but what kind of joint is that? So the ones in your skull. Sort of. More specifically, begins with an S, but suture. Very good. So those suture joints are called synarthroses, and they're made of fibrous connective tissue, and they're not supposed to be moved. So these are immovable joints, synarthroses, and yeah, they're typically found at suture joints. Now, when the baby's first formed, these are a little bit more pliable, right? And if you've ever seen the soft spot at the top of the head, the fontanelle, okay? Yeah, well, understandably, because you're thinking of that compression on your skull, which would not be good now. All right, so those are synarthroses. Then we have, so these are the immovable joints. What do you think the other 2 types of joints are? Movable and slightly movable joints, right? So, if you remember, we're talking about the pubis symphysis. That's a type of amphiarthrosis. It's made of cartilage, slightly movable. Your intervertebral discs are like that too. You have a little bit of a range of motion that they can go through, not a ton, right? You can also do flexion and extension at your spine. Okay? Pubic symphysis, again, we talked about childbirth again. For women, that's a more pliable region. Okay? For men, not so much. And it becomes more pliable, obviously, once they're pregnant and getting ready to give birth. The last type of joint, obviously going to be our highly movable ones, the diarthroses. And these are the synovial joints. This is where we will concentrate most of our focus. You learn all the different joint types of synovial joints. And we're going to look at those characteristics, which you can sort of see in the background, though. Any questions thus far? So a good way to remember them. Synthesized together, synarthroses are kind of stuck together. Diarthroses are more dynamic. If that helps to help you remember. All right. So several different parts of the joint cavity, or the synovial joint. First thing, ligament. You can tell me what a ligament is. Got that a little bit already. That's 10. Bone to bone, very good. So that's going to attach bone to bone. And ligaments are there basically to help reinforce that fibrous capsule. Okay, so the capsule is made of fibrous cartilage. Ligaments are made of fibrous cartilage. It helps to support it. Joint cavity. Does anybody know what's located inside a joint cavity? Yes. Very good. Synovial fluid. All right. So it's surrounded by the articular capsule. Whenever you hear articulate, does anybody know what that word means? Because it means stuff outside of. Okay, so how you're talking about it. And then articulate is kind of where it comes together. Okay, so the different articulations on the body are where the joints come together. So we're looking at, yeah, obviously different synovial articulating joints. And yeah, that fluid is there for cushion. Articular cartilage, again, where it articulates. This is hyaline cartilage, so it's a little bit more pliable than the fibrous connective tissue. I mean, it's able to bend a little bit more. Mostly used as a cushion there, because even though there's that fluid located, you can still have a bump or a grind in between things. And then fibrous articular capsule, again, just enclosed by fibrous connective tissue and lined by the synovial membrane. The synovial membrane will secrete synovial fluid into that joint. Okay, and that's replenished on the regular. The last couple things are bursae and tendon sheaths, or bursa, some people say. So basically, flattened sacs with synovial fluid in them, added for protection. That's what the bursa capsules will do. Tendon sheaths help to reinforce the tendons, make them more stretchy. That's about it. Any questions?